All right, good morning, everyone, and welcome. I'm Joe Clark, and I will call the meeting of Eckerd Connects Community Alternatives Circuit 13 to order. The first item we have is the approval of the minutes from our October 23rd meeting. I have reviewed them, I do not have any changes. Are there any additions, deletions, or corrections to the minutes as presented?
Not here.
All right, hearing none, those minutes will be accepted. We're at a new venue today, kind of moving it around in the community to see if it's more convenient for folks to join us. So I would welcome any members of the public, and if any member has any comment they would like to make, I invite them to stand to be recognized. All right, thank you. Let's move to item 3, our CBC update. I'll call upon Arita Shirley for our director's report.
Good morning. I would like to draw the board members to tab 3 of the board package, which contains the executive director's report. I would like for the executive director's report to stand as is this morning so that we can have a broader discussion regarding our system of care and a brief update. And as you know, over the past 3 years, our Hillsborough County child welfare system has faced a 40% growth in our foster care population. And 2 of the primary reasons why children in Hillsborough County are coming into care are related to the opioid epidemic and domestic violence. It is without question that this sustained growth has had an impact on our system of care and has resulted in some challenges. And Eckerd Connects will continue to partner with our providers, our stakeholders, with the Department of Children and Families, and others to address these challenges, including advocating for Hillsborough County to receive an equitable share of state funding to address the growth that we've experienced. Now, we've discussed with the board in the past the process that the Department of Children and Families developed to address when a lead agency has experienced an excess of 10% growth of the front door of the child welfare system. And DCF stratifies growth by lead agencies based on the front end penetration rate. So they look at entry rates across the state to determine which CBCs have experienced the greatest amount of growth. And based on that stratification, they identify these lead agencies as Tier 1 CBCs, first in line to receive additional funding. Unfortunately for Hillsborough County, despite being established as a Tier 1 CBC, we only received $169,000 in risk pool funding, and that was primarily attributed to another Tier 2 CBC having some financial challenges and being awarded over $1 million of the funding that would have typically gone to Tier 1 CBCs. So the funding disparity continues to add to system stressors, and we must address that in order for children and families to have adequate access to services here in Hillsborough. Now, on a positive note, in addition to some of the financial challenges associated with the growth, I did want to share that despite some of the challenges with our penetration rate, Eckerd Connects, in partnership with our providers who are present here today, our stakeholders, and the Department of Children and Families, has continued to focus on improving outcomes for children and families involved in our local child welfare system. I'm very pleased to state this morning that Hillsborough County is on pace to achieve adoption finalization for well over 325 kids this year. That type of performance will be the highest in the last 3 years. And so I want to commend all of the agencies and stakeholders and providers for working together with us to make that happen. In addition, most folks aren't aware, but as of last month, Hillsborough County actually was second in the state for ensuring kids exit the system timely within the first 12 months of entry. So we're really proud of the system for really staying focused on ensuring that when kids can go home, they are going home timely. Again, I want to just take a moment. I know that it is without saying how difficult of a task that can be when a system is stressed in a way that Hillsborough County system is stressed. So I do want to just acknowledge and take a moment to applaud the agencies who are present today for the continued focus on the safety of our kids and the outstanding work that they've done. So we can just take a brief moment and just acknowledge them for that. Now, as you know, Eckerd Connects has made a decision to discontinue our contractual relationship with YFA, and that's going to be effective on May 7th. So I did want to share with the board an update on the ITM process. As you are aware, we issued an invitation to negotiate on February the 12th, and interested agencies who would like to submit a response to that invitation will have to submit an intent on February the 28th. We did develop an ITN evaluation team that's comprised of not only Eckerd Connect staff, but also members of the community. And that's historically how we've identified and selected providers to join our network. And so the committee will be comprised of representatives from the Office of the Attorney General. We're going to have a representative from the Guardian Ad Litem's office on that panel. We'll have a representative from the Hillsborough County Children's Board on that panel, and collectively, those individuals, in addition to Eckerd Connect's employees, will review all of these submissions and determine which provider is best suited to take on this book of business. The committee will convene and issue a notice of intent to award the contract on April the 9th, and the goal is for us to have the new provider in place actually managing that book of business no later than May 8th. So that concludes the much broader update, and did the board have any questions?
Yeah, I just curiously, I think I know the answer, but I think it's prematerial to Eckerd's relationship as a service provider to the CBCs and other programs with the state. This decision to direct funds to another CBC who was sort of I guess a hardship case of sorts, right? Stressed financially. And for us to, with perhaps a greater need in terms of monetary sum, being allocated a smaller portion. And I suspect, and I sense that that is not a stress to us due to how we manage our finances. Provisions of lines of credit, things like that. So how are we meeting that demand? Because this is a fairly sizable demand in terms of a shortfall, and needing to fund the program with not full funding in terms of the costs associated with the levels of activity we have. How are we managing that? I'm not sure if that's an answer, a question for Randy or for you.
I will say that the $4 million projected end of the year deficit can be attributed to the increase in room and board rates of kids entering the foster care system. So that largely accounts for it. And at this point, what we're doing is really closely managing all of our service array, making adjustments as we can throughout the year, and working with the Department of Children to, and with our legislators to look at back of the bill funding that we hope we will receive sometime towards the end of April or the beginning of May, which will then allow us to be able to manage through the end of this fiscal year without any cash flow issues. I wasn't sure, Pam, if you wanted to add to that or?
Yeah, Lorita's correct. Prior to DCF making that decision, they did have us do a cash flow analysis. And what they wanted to see is, did we have enough cash to get us through before they were able to distribute back of the bill? We'll be a little light, but for the most part, I think as long as we get it you know, in the April, May timeframe, we'll be fine. I do know that Randy is working on a line of credit, and I don't know if he wants to talk to that.
We're in negotiations with Bank of America on a line of credit, just in case we have a cash flow need prior to receiving that relief
Gotcha.
from
Gotcha.
the state.
Yeah. That's helpful. Thank you very much.
Any other questions? I just make a kind of an observation. I remember in preparing for this meeting, I was looking back at some of the comments that Secretary Carroll made when he addressed us here, and also when he gave a speech in the community, I think it was last spring. And he noted that Florida ranks number 4 in the nation in child abuse reports. And as Loretta highlighted, in the past 3 years, our county has seen a 40% increase in this system. So this is, by way of example, I think as of this past fall, this number may be a little off, but October, November, despite having 700 more children in our system, we rank 18th in funding, whereas Miami ranked number 1. So these are disparities that cause stresses and challenges to the system that as a community we must address. And I'll comment a little bit more about that later. Any other questions or comments?
Yeah, I guess just a question of observation, and given those disparities between Hillsborough in attributing cause to that, I know that's not something that is an exact science.
Right.
We can formulate some intuition, maybe some data points, and have. But as I understand it, it's a bit of a mix, obviously driven by some of these social conditions that might be a bit more acute here in Hillsborough County, but also other practice. Do we still suspect that there's not a balanced and accurate practice of adjudicating these removals? Or do we feel different about that today?
Well, I think to your initial point, there are some social factors that have significantly impacted the rate in which kids are entering the foster care system here in Hillsborough County. One of the opportunities that we will have upcoming is the peer review. And the peer review team will have an opportunity to really look at all the social factors. They'll work with the sheriff's office to really focus on why they believe kids are coming into the system at a higher rate. They'll look at the rate in which kids are served and they're exiting our system of care. I think that the peer review team will issue a report that really gives us a complete understanding of the system challenges here in Hillsborough County. So we are looking forward to the process and to their findings. I will say that this has been sustained for the last 3 years. So what we're saying as the lead agency is, if this is our new norm, then funding must follow. And you know, I don't want to necessarily state that we shouldn't have 40% increase in the growth of our foster care system, but if that's our reality, then the state dollars should follow, and Hillsborough County should receive their fair share so that our children and families can continue to receive access to the services that they need.
Sure, yeah. Yeah, those kind of growth rates are just problematic beyond sort of the typical direct expenses in terms of the demands on our organization to build other responses to manage those types of demands of growth. That would be true of any organization that was subject to any kind of growth of that nature. And of course, when the resources are what they are here, that becomes even compounded, as in terms of the challenge that it poses.
And the funding structure is very unique in that folks generally believe that in a system this large, you really just have a lot of money to play with. But a lot of the funding, millions of dollars, go out in direct payments to families who've gone on to adopt kids through adoption subsidies. And we have millions of dollars that go directly to room and board payments to ensure that kids have a safe place in which to reside while in care. And so when you establish a system of care that was initially designed to serve about 2,800, and then you see that penetration rate go up, the only way to adjust for that is to either reduce services for kids, which we made a decision not to do, or incur a deficit, and then really look to the department to ensure that the county is receiving its fair share of the funds.
I guess just as a follow-up to that, a couple of points. Dennis, our community is, I guess, unique in its challenges, and this is discussed at a number of forums here in the community, including the Community Alliance, and that is what brings children and families into this system. And as Sarita mentioned, the drug crisis is real and significant here and every place else. Domestic violence is a significant contributing factor. Housing is a big issue. Removal of children is a short-term solution. And I've heard Ron say this a number of times. And unless we are able as a community to get beyond effectively managing what we have and address the underlying issues that bring children and families into this system as a community, we're going to continue to struggle. It's going to be very challenging. One final point, we have internally, and I guess it's distributed in other venues as well, a little tool called the one-day snapshot. And it gives us a breakdown of children by age and where they are, where they fall in the community. That's kind of helpful. And I was thinking that it might be helpful to include the SNAP for Hillsborough, modify it, because I'm looking at the one that has both Circuit 6 and 13, which as of December shows us with about 3,867 children in our system. And this is kind of helpful because it shows how these populations are broken down by age group, and we kind of see where everything falls. So maybe we could see if that's a good idea or not. I find it very helpful.
Yeah, I think it definitely is helpful, Joe, and it would provide some context to where funding is being spent. Again, just when looking at room and board payments for kids, we're probably going to spend $19 million this year just in room and board payments for the kids coming into the child welfare system because it's grown so significantly. And then we're spending an additional $18 million just in payments to families that have gone on to adopt children out of the child welfare system. So a considerable amount of funding that we receive goes directly back to support the kids who are coming into the system. And that's why it's so strategically important for us to continue to work with the state and with our local legislators to ensure that Hillsborough County is, in fact, receiving that additional funding to account for the kids who are being removed and coming into our system of care.
Thank you. Any other comments or observations?
I think I just want to make one comment. I want to make sure that people clearly understand that when the Department of Children and Families says that through funding in the back of the bill, they're going to make a particular lead agency, our lead agency, or any other lead agency that's running a deficit in at-home care whole, doesn't mean that they're making the system whole. All they're doing at the end of the day is covering the expense that has already occurred. What they're not doing is providing the funding that's needed to support the children who are in the system and the families and the services that those kids need. You know, I think it's important to remember what Loretta said. The system of care is built on an assumed level of demand for service. Our demand for service is significantly higher than that. So while we've got, maybe 1,000 kids in paid placement, we shouldn't have 1,000 kids in paid placement. What that means is resources that should be going into services for kids and families to keep them out of the system, services for kids and families to get them through the system quicker, address the issues that Joe brought up in terms of substance abuse, mental health services that need to be funded for, particularly for our teens who are most traumatized because of the family situations that they come from. Those resources aren't available. And that's why that kind of conversation is really, really important to know and understand. Until we, as long as we're in this position where we have substantially more children coming into the system, and I'm not saying that's a bad thing. I'm not saying kids shouldn't be coming into the system. What I am saying is, if that's the case, then we had best better be setting back getting the resources that we need just to adequately support those kids and families. That's all I
Thank you.
want to say.
All right, Rita, shall we move on to review the performance standards?
So that's part of the executive director's report that we're letting stand as is.
Okay.
I would like to move forward with the discussion of our financials at this time.
All right. Let me ask, are there any, does anybody have any questions about the scorecard or any of the answers? I think it's pretty well self-explanatory, and Rita mentioned,
And our performance, again, will read vis-a-vis the other 20 community-based care lead agencies.
So when we look at total performance, which includes the state and federal performance metrics, and we look at Hillsborough compared to the rest of the state, for last month, Hillsborough County ranked fifth in comparison to the other CBCs statewide overall with
And
performance.
that's on the department's evaluation.
It's replicating a methodology that the department used previously to rank CBCs, yes,
20.
There's 20 CBCs.
right.
correct.
Yes,
Yeah. Okay, well then we'll move to item 4, our finance report. Pam?
Okay, so behind tab 4, you'll find the financials. We are going to be reviewing the financials as of the end of December of 2017. As Loretta had mentioned, over the past few years, we have seen a 40% growth in residential placements. Just for this fiscal year alone, in the first 6 months, we've seen licensed care growth of 10%. And therefore, we are projecting a year-end shortfall of $4.1 million. This shortfall was originally 4.3, but due to the $196,000 that we got in the risk pool funding, as Loretta had mentioned, brought that down to the 4.1. Also, as she had mentioned, we are anticipating some back-of-the-bill funding.
With just a correction, 169,000, right?
Correct. Yes. 169 was the risk pool funding, yes. As Loretta had mentioned, we are anticipating some back-of-the-bill funding to hopefully cover the remaining deficit. Currently, both the House and the Senate have $10 million in their budgets for back-of-the-bill. The DCF currently has $30 million in unencumbered federal money, and they're trying to get $9 million of that also put in the back of the bill. There's 2 areas within the Department of Children and Families contract that I want to cover. One is contracted services. We are projecting a negative variance of $588,000, and if you recall from our last board meeting, that was due to some additional services that were put in, increasing our contracts in order to address continued growth in the system. The other areas are out-of-home care services. As Loretta had mentioned, we are projecting a $4 million deficit.
Pam, the 588 that went out,
Mm-hmm.
categorically, where did it go?
Some of it went into case management, and then some of it went into kinship, I believe.
Kinship care.
Okay, so, also part of our community-based care integrated health, we are projecting to yield about $401,000. So, unless there's any questions, that concludes my financial report. Loretta, do you have anything?
Yep, I think you addressed it.
I don't have a question about that, but I note that, that we have a DCF enhanced prevention category that came into effect in January 2016, and perhaps it would be helpful to get an update on that sometime as to how that's panned out. How did that work? What do we know about it? So,
Okay.
yeah, don't need to address that today.
Okay.
So, just, sorry.
Yeah, go ahead.
Just as a practical matter, and I know that we face this regularly in terms of shortfall with out-of-home care, at least over the last several years. What do we have to undertake as an organization to pursue and procure additional funding from that back of the bill? What's that process like for us over the course of the year? What work is involved, really, is what I'm looking at. Just kind of trying to understand what demand there might be on us in light of this reality that we have to live with of having a deficit.
From an operational perspective, Eckerd is a member of the Florida Coalition for Children, as is all lead agencies, and so we strategically work together throughout the year to really understand the entire demand of growth in Florida and what it would take to sufficiently address the needs of all Florida's kids. And so we identify through that coalition legislative agendas to really support all kids in child welfare. And we begin to work by educating our legislators locally and statewide on the increase and the demand for services in Florida. We keep data in front of the department, and we continue to work with them so that they're fully aware of the demand of growth on the system and how it's impacting all of Florida's kids. So there's a lot of work that happens around the year, throughout the year, through this coalition to address that. And it really is incumbent upon each lead agency to stay in front of their delegation. We take that very seriously, so we meet with our delegation to keep them abreast of the challenges here in Hillsborough County. And then as a collective group, we really try to lobby for additional funding to address whatever the shortages are that we've documented throughout the year. And I'm not sure if there's anything else.
And just by way of personnel, how many different people might be involved in that effort on our part?
Multiple people on Eckerd's part. It really takes leveraging our support center, our QA folks, our data folks are always pulling data. You have everyone from our CEO all the way down really looking at data, strategizing, really making the case for why Hillsborough County needs to receive additional state funding. And so it's difficult to quantify it because it really involves so many of our lead agency staff. We have providers and stakeholders also working with us to make that case for additional funding.
So this reality, in some respects, is meaningful demand on us and the others who are in the system providing care.
Yes.
It's unfortunate.
Am I correct? This isn't, just Hillsborough County. This is our, and this isn't about DCF sitting on a giant pile of money and not doling it out.
Correct.
It is a statewide issue that really has to be addressed at the highest level as to whether we're going to adequately, whether we are going to invest in children and families adequately to achieve our goals. So,
Yeah. I think to your point, Mr. Clark, I think the issue with Hillsborough County is that we're now the largest catchment area in the state. And despite not being the largest, obviously, with the census population. So there is something very unique and challenging happening here in Hillsborough that requires a lot more focus on the system of care. And that's what we've been doing with the department and hope to do as well with this peer review team when they're on site here to really understand these challenges.
So has there, in the coalition, has there been any good thought with regard to public policy that might be furthered or established that would address this reoccurrence of this issue that we're experiencing of funding shortfall?
All right. Right now, the focus of the coalition is really primarily on educating the stakeholders on the fact that since Florida has privatized, we're serving more kids earlier on and early prevention and early intervention services. So it's costing the state more, but we're achieving a lot better outcomes, and really trying to get folks to understand that this is not about just needing more money year over year. This is about serving more kids, keeping them out of the system, so we have more kids never entering the system that would have. But with some of the kids who are entering the system, what are we doing to really provide them with supports needed so that we can reduce the recidivism rate of kids coming back into child welfare and really break the cycle long term? There are some policies that we're looking at. Obviously, Florida is threatened right now at losing the Title IV waiver, which provides the flexibility to serve kids earlier on before they even are formally involved in the child welfare system. So there's some work being done to really look at how Florida will recover from the loss of the 4E waiver. I just yesterday had an opportunity to meet with Kirk Kelly, have a conversation with him about legislation that's needed to address the reality of the child welfare system being a no eject reject system, meaning we have to serve all the kids that enter the child welfare system. But the child welfare system isn't equipped to have providers that are willing to serve all the kids to enter the child welfare system. And so we are talking about the need perhaps for some policy to address that issue.
Yeah, I'm just wondering about if there was a means by which the legislature could address managing the need for additional funding, set of rules that would sort of, if they existed, would ensure the awarding of that funding in a manner and form that it wouldn't require sort of this a level of stress that it puts on providers to try to lessen, manage expense, as well as the efforts that go in terms of lobbying and educating the public around the need for this funding.
Right.
Yeah.
I will say, because we work so closely with Secretary Carroll, that because of the unique situation here in Hillsborough with some of the funding challenges, we did work with the Department of Children and Families, and they will be looking at changing how they allocate the dollars that are awarded to lead agencies, really providing additional funding up front, and so that lead agencies can absorb the impact until additional funding is received towards the end of the year. That's a practice that currently, lead agencies receive 2 months of revenue at the beginning of the fiscal year, but then you skip a month. So it kind of balances itself out in September. And this new way that they're going back to, they're really saying, because of the penetration rate, we want to award 2 months up front, and then that doesn't get adjusted out until the end of the fiscal year, allowing sufficient time for any new revenue to be received. So we're very pleased about that decision on behalf of the Department of Children and Families. And again, that change in practice can largely be attributed to discussions that Eckerd had with the state about the impact here in Hillsborough County.
Good work.
Okay, Ron?
Mr. Chairman, I think 2 points. Number one, in addition to advocating for resources for child welfare, there are important community players who are critical. Their success is critical to our success. Our substance abuse and mental health providers in this community need resources to deal with the situations that they're facing with. Children are entering the child welfare system because families can't get right now the mental health and substance abuse services they need up front to prevent spiraling out of control and into the child welfare system. So my advocacy is that, yes, although we should be advocating for the child welfare portion of the system, we need to also be advocating for appropriate funding for mental health, both adult and children mental health and substance abuse in our community as well. And then the second thing is, you know, when you look at this, at these financials and you look at a $4 million deficit, right now today, that $4 million deficit is funding dependency case management in Hillsborough County, I believe, at a ratio of 1 case manager to 17 children. Is that correct?
Yes.
We ought to be operating at 1 to 15.
Correct.
If we were to go from 1 to 17 to 1 to 15, this deficit would grow by what, $2 million?
Easily,
Yeah.
At least?
at least.
That's the kind of problem that not having an adequately funded system of care as a base is causing us. Thank you.
Thank you, Ron. Well, you know, I'll just, your comment is, comments are spot on. And I know that a number of agencies, including our children's board, is acutely aware of the need to have funding to effectively address the underlying issues, as you pointed out, which bring kids and families into the system, such as mental health. I mean, everybody knows that that is significantly underfunded in our county. And I know that Secretary Carroll, when he addressed us, highlighted that, said we have to have services that effectively address these underlying issues. Mental health is huge. So we'll keep addressing our advocacy efforts to those ends. All right.
Mr. Chairman,
Yeah.
one last thing. I know you are working diligently to manage this out-of-home care deficit, but at the end of the day, don't let trying to bring that down be the driving factor, if you know what I mean. Whatever needs to happen, and we'll deal with the downside of it on the back end.
Noted.
Thank you.
Okay, by way of action, do we need to, I guess we need to accept the financial report?
Yes.
Okay. Well, I'll accept the motion.
So moved.
All right.
Seconded.
All in favor? Aye. Good. All right. External relations update. Josh, welcome.
Yes, sir. Thank you.
What's going on?
Some remarkable things going on at ECA 13. You'll see some of these things behind tab 5, and I just want to highlight a few of them for you today. 2 of them focus on a couple of our adoption events. You'll see there on page 1 after tab 5, our National Adoption Day during National Adoption Month in Hillsborough County in November. We had 22 children adopted in November on National Adoption Day in Hillsborough. Our theme was Adoption Rocks. We had a band there for the kids to listen to. I want to thank all of our supporters who came out as well, including the Heart Gallery that was so gracious to take the first Forever Family photo of these families. They gave it to them in a frame while they were there, so that was really cool. And another upside to this, we saw an increase of inquiries from folks in the community wanting to foster and adopt, coming through our phone lines and also through Facebook and our website as well. The next story I'll highlight for you is the next page, also focusing on adoption. It's our Home for the Holidays campaign. During this campaign, we were able to expedite and work with folks to expedite the process, not only with reunifying kids with families when possible, but also finalizing 14 adoptions, 14 children into 11 different families on that date back in December 27th. And if you know anything about the courthouse during Christmas week, it's kind of like a ghost town. So I do want to say thank you to Judge Jack Espinoza. He took time out of his busy schedule, took time out of his holiday retreat to come back and make sure this was on the docket, and he was there that day to make sure all 14 of these children got adopted into these 11 families, including the little girl you see there in the picture with her new mom. A quick mention here on the final page, you can see these are some of our employees, and this is our staff spoke, and Shar McLean and her team here, and they're dressed like elves, as you can see, which is always nice. They went out and did something that's a great example that we can all do our part especially over the holidays, to remember what our foster parents are doing. And they got all decked out. They loaded up with all these gifts in these bags, and they honored a local foster mom and the children in that house and took them gifts and dropped them off and surprised them and made sure they had a little extra joy this holiday season. So thank you, Shar, and your team for doing that as well. One event I do want to mention that's coming up this Sunday from 1 to 5, March the 4th at Lupton's Ranch. We'll have our annual foster family picnic, which is always a big deal. I was talking to some of the folks who were helping us organize last night. Somewhere between 500 to 800 families will come out and celebrate this weekend. One cool thing that they do at this event, they have a lot of our foster children write letters to veterans and to other American heroes, and we're going to distribute those to the Veterans Hospital and to other places as well in the near future. I did want to thank Lisa Sims, because I just saw her come in a little bit ago. They did an amazing event over this past weekend that I'll have in my next quarterly report called Operation Prom Dress. They collected prom dresses. They thought they'd get a few dozen. They wound up with about 800, a lot of them brand new with tags. And girls came out, not only in foster care, but other girls in need in the community came out. And when they put these dresses on and looked in the mirror, I'm talking like waterfalls. I mean, it was a lot of emotion, a lot of tears. One mom leaving with her daughter said that she was a teen mom herself and couldn't go to prom, and we were giving her daughter something that she wished that she could, and she was so grateful and so thankful. So Lisa, thank you and your team. I know you worked late Friday night getting it all together and Saturday all day, so thank you very much.
Great job, guys.
Thank you. It's so important to celebrate good news. You know, good news doesn't sell. Airplane landed again safely. Woo woo. But there is a lot of good news, and it's reflected by, you know, the dedication of the people, our people in the community. And I noted, and we hear about this all the time, and maybe next time we could highlight our relationship with the faith-based community, which is really incredible. Kind of under the radar, but every day, people working with youth and families. And it just happens almost invisibly, to my view, and it needs to be pointed out. So we celebrate that. All right, any other questions for Josh? Fellow board members, any remarks for the good of the order?
No, sir.
Okay. Well, I'll, the chair's report, I really do not have a report, but I would like to just kind of take a moment and summarize. And what it really comes down to is to thank all our partners, our employees who inspire us every day with their dedication, providers, advocates, law enforcement, the judiciary, and others, because they recognize that success in addressing these child welfare issues involves working as a community in concert, hand in hand. And that's how we will be successful. So thank you to them. We do look forward, as Larita said, to the peer review process, which will begin shortly, and we will be following up with a comprehensive report on those results. So thank you, and with that, we will stand adjourned.
All right, thank you. Yep, if you could, please. Thank you.